Hi, everyone. My name is Angela, and on behalf of Dr. Nadi and our staff, I want to start off by saying that the information that we are covering today will forever change how you look at breathing and the importance of airway for you, your kids, and your family as well. Something that we do like to say on this side is once you know this information, you can't unknow it. And that's a good thing because your entire health depends on the health of your airway. You may have questions, so please feel free to type them in the Q&A section below. So that way at the end, you'll be able to answer your questions. Let's get started. There's a silent crisis here in America. So our research has shown that 9 out of 10 Americans suffer from one or more of these conditions. So just to highlight a few, ADD, ADHD, anxiety, snoring, hypertension, bruxism, the dark circles under the eyes, crowded or crooked teeth. So again, we see visible symptoms, ADD, ADHD, the mouth breathing, people with chronic allergies. So what is the underlying cause? What's really happening? A compromised airway. So what's causing this compromised airway? What could be a root cause? So we're having underdevelopment of our upper and lower jaws. Well, what's causing that? Some studies have shown soft food diet, weak tongue posture, even weak orofacial muscles. Here's an example of a functional airway. So as you can see, the airway is almost the size of a garden hose. So the nasopharynx is your upper airway and the oropharynx is your lower airway. The oropharynx contains your tongue function. So a lot of it is compromised if you have bad tongue posture. Here are some examples. So we have someone with a severely constricted lower airway. So you can see that's the oropharynx, what I just had talked about. So the tongue is sliding back, causing that restriction. Then you have a typical mouth breather. So that agitates kind of right in the center of the airway there. And then you have a child with Asperger's syndrome and then adult with sleep apnea. So which airway would you prefer would be my question to you. Do you want a straw or would you like a wide garden hose? I would choose the wide garden hose. So we have Dr. Robert Corrigini. He is an anthropologist. He's done a lot of research. He uses fossil studies in a lot of his research and even some population studies. Just some examples of skulls that he looks at. They actually house all 32 teeth. How is this possible? They definitely are straight, as you can see here, and they didn't have orthodontics back then. So his population study was consistent with findings among the isolated rural populations around the world. And he found that women are actually breastfeeding for many years, up to 3 or more. They have a hard food diet. There's little to no incidences of crooked teeth or other degenerative diseases, and they are perfectly forming the upper and lower jaws. So just in a conclusion that he made is the dietary consistency and the toughness actually promoted the proper bone growth. When the processed foods became normalized after industrialization malocclusion, which is crooked teeth, was showed as a rapid rise. So soft diet and a processed food increase the underdevelopment of the upper and lower jaws, which created the malocclusion. So another study that was done was when the Western culture and the soft diet was introduced to these populations, they saw a dramatic change in the rate of the malocclusion. By the first generation, you're looking at 50%. By the second generation, you're looking at 70% change. And by the third generation, 85%. That is huge. So most malocclusion is acquired, not inherited. Malocclusion is a disease caused by our Western culture. Some of our Western culture influences, as you see here, is inadequate breastfeeding, bottle feeding, and a soft food diet. Women are working, so you're lucky if you get 6 months of breastfeeding in. You have to use the bottle to feed the baby, especially if you want help to be able to get rest. But that's not allowing them to use their proper facial and tongue function. The soft food diet, we worry about the kids choking, but they're not, again, able to use their facial muscles. This is the way it should be. So the conclusions is most malocclusion is acquired, not inherited. The malocclusion is unique to our Western culture, and the presence of malocclusion is the key indicator of the underdeveloped airway. Research by Dr. James Sim Wallace. He said that an early soft diet prevents the development of muscle fibers in the tongue, which is resulting in a weaker tongue, which cannot drive the primary dentition out into a space relationship with fully developed arches, which will lead to more crowding of the permanent teeth. I have an example here to show you. So the tongue is a scaffold for the upper jaw. So what that means is as your tongue is pushing on your palate, it is creating that space and that broadness that we should have. And here's another example. So this is kind of what we're seeing a lot today, especially in the dental office, people with Gothic arches. And this is what we want to see is the arch, beautiful, broad, having enough housing space for that tongue. So here is the skull again. Our results suggest that the dental arch expansion improves sleep disordered breathing in patients with the upper and lower jaw constriction and can be a valid treatment. So this is just going to be a short informational video. So I'm going to go ahead and share that with you.
Just a few hundred years ago, the human face was different. It was forward grown. Her wide profile and large dental arches ensured straight teeth and room for her tongue. Most importantly, she had plenty of space behind her upper jaw so she could breathe through her nose with ease. The modern face has changed. From childhood, her dental arches are less developed, crowding her teeth and giving her less space for her tongue, which impacts her airway. Many believe this stems from a number of causes, such as allergies that affect breathing. Another is the poor nutrition and softness of modern diets, causing toddlers to have underdeveloped chewing muscles and smaller dental arches. Because her upper jaw is too far back, she will struggle to breathe normally through her nose. To get more oxygen, she will compensate by opening her mouth to breathe, bringing her lower jaw down and back, creating a downswing of the face. This is how her undergrown upper jaw creates the appearance of buck teeth. She's actually compensating in order to breathe. If not corrected, the problem carries into adulthood. Extractions were documented in the 1600s as a way to treat crowding. Although they are a quick fix, they don't treat the problem of underdeveloped arches and have been implicated in harming the facial profile, making them the subject of much debate even today. In order to breathe, she will slouch her head forward to prop open her airway, creating a lifetime of neck and back pain. This is the infamous forward head posture. Having a healthy airway is crucial to the survival of life, and especially so during sleep. When muscles around the throat relax during sleep, a healthy airway stays open because the tongue is sitting forward and has enough space to be suctioned up against the fully grown palate. With underdeveloped jaws and dental arches, the palate is too small for the fully grown tongue, which is sitting back to begin with. When she sleeps, her tongue does not suction, rather it falls back and cuts off her airway. This is obstructive sleep apnea. Like crooked teeth, it's a modern condition, however, it can reduce life expectancy. Not surprisingly, obstructive sleep apnea is marked by the same traits that describe the headgear effect. Both jaws are grown down and back, creating a clockwise rotation in the lower third of the face. The myth of the overgrown upper jaw that needs to be held back has long since been replaced with science. Science has shown that young children can be buck-toothed naturally, and that the lower jaw catches up over time with a fully developed upper jaw. Essential to this is nutrition, the use of chewing muscles early on in life, and good breathing habits. This means breathing through the nose with the mouth closed and the tongue resting up against the palate. Also, the practice of maxillary expansion has been shown for over a century to correct crooked teeth and improve nasal breathing space. And since 1918, orofacial exercises have been shown to correct mouth breathing habits.
Well, that was a lot of good information. Kind of broke down everything that I've spoken about up to this point. Nasal breathing versus mouth breathing. So mouth breathing causes agitation. Nasal breathing, it actually warms, filters, and humidifies the air that you're breathing in. So a compromised nasal airway, so mouth breathing, soft diet, it consists of a low tongue posture. You want your tongue to be sitting and resting right up against the top of roof of your mouth, okay? Mouth breathing will cause the tonsils and adenoids to swell, the agitation in the back of the throat. If only we had known, what about my child? What about my spouse? What about me? So this is Dr. Tara Griffin, and she's from Florida. She went through the appliance therapy as well. Something that she didn't like was her gummy smile. She is a dentist, and she actually, after I think it was 5 years being in practice, she was having so much pain. She was ready to retire. She didn't want to do it anymore. She was wanting to find something new. So she transformed her life. Then she did it to her practice. So here we go. She made a little video for us.
I'm Dr. Tara Griffin. We are here today in my clinic in Panama City Beach. I've been practicing dentistry for over 11 years. Before I discovered the Vivos appliance, I was suffering every day with chronic head and neck pain, TMJ pain. I was practicing dentistry and been practicing for 5 years, but I was already looking for an out. I knew that with this much pain, I could not continue to practice dentistry. I had chronic sinus and allergy problems, bronchitis. I was not sleeping throughout the night very well. I was waking up during the night. I had severe daytime fatigue where I would need to go home and actually take a nap in the afternoon, just at lunch, you know? And so I was looking for a solution to the problem, but I didn't know what the root cause was until I learned about the Vivos appliance. As soon as I started treatment with the Vivos appliance, within the first 2 nights, I was sleeping soundly throughout the night. My energy was better during the day. The pain that I was undergoing took a bit longer to get resolved, but within the first 3 to 4 weeks, my pain level was reduced by 2/3 or more. Within a month's period of time, I was breathing through my nose better. I wasn't having the same sinus symptoms that I was having before. And within 3 months of treatment, my asthma had improved so much, I had no more problems with the inhalers and the frequency I was having to use with all of my asthma inhalers. My overall health started to improve very quickly. I was my own first patient. However, as I continued to treat the next patient and the next patient going forward, I was curious to see if they were going to have the same outcome that I had, and they did. 9 out of 10 had the very similar outcome that I had. So they were sleeping better in just a few nights, actually getting their energy back. They were less irritable. The pain that they had was going away very quickly. The teeth were beginning to straighten and align over time. So even though with this type of problem, it can take some time to get the long-term results, the immediate symptoms start to improve very quickly. Comparing my before and after picture with the Vivos appliance, my smile was not symmetrical. My teeth were crowded. The gumminess of my smile was a major problem that I didn't like. I had unevenness in my eyes, also in my nose. My face was more round and less balanced, and that all helped to correct itself as well as I went through the treatment. When the Vivos appliance is worn in the early evening and while you sleep at night, it allows the jaw to relax. It allows the airway to open up. It allows you to breathe through your nose and to get the oxygen that you need to the rest of your body for your body to begin to heal. By breathing through our nose, we are actually getting much more oxygen to our brain as well as our lungs, and we're producing nitric oxide, which is a vasodilator to allow the blood flow and everything to circulate better. And so a big component with this is it forces you to actually breathe through your nose to get the oxygen where it needs to go into the body. So that's a very important part of this. If you're interested in learning more about the Vivos appliance, if this would be good for you, then I recommend you coming into a Vivos center to be evaluated to determine if this is something that could help you.
It's amazing, right? So here's an example of an airway of a patient, specifically an adult patient that went through therapy. So in figure 7, you can see that the upper airway, the volume was very low. You can see the constriction where it's showing the red. And then after 15 months of treatment, look how much more airway is there. It's almost quadrupled, tripled it at most in size. It's amazing. So this is a testimonial of this patient here, and she was suffering from TMJ. She didn't like her gummy smile. So she went through treatment, and she said that when she was smiling after she was going through treatment, that she noticed that she's physically unable to smile as big as she used to. Her gums are now barely showing. Her face feels different when she smiles, and she doesn't know how to explain it, but it's a great thing. She said, when I speak and eat, my jaw no longer pops. I can speak more clearly and feel a noticeable difference in the amount of room my tongue has. I can breathe very well through my nose now. I'm very happy with the results. So the Vivos way, and something that we do here at the office, is we promote healthy nasal breathing. We do train the tongue, and we like to eliminate bad habits. So by discouraging and limiting mouth breathing, we'll give you a few options of how to treat that. Training the tongue, doing myofunctional therapy to actually exercise the tongue. It'll reposition it up and forward, actually going into the palate there, the roof of the mouth. Some bad habits are thumb sucking, tongue thrust, and reverse swallow, things that we're going to try to eliminate. So some treatment protocols that we do here is we do complete a full exam. We take a 3D scan, which helps us to evaluate the airway. We do digital imaging, digital photos, and we also want you to take a home sleep test. And then we'll personalize the treatment according to you as the individual, and then we'll review that with the doctor. So the breathing wellness movement, it's just a quick video on what we are doing and where we're going.
I really feel like Vivos is one of the great answers to the healthcare crisis that's in America, because we're getting to the root cause of what ails a lot of us, and that is not breathing well and not sleeping well.
If you trace back the journey of a sleep apnea patient, that patient is suffering for years before they ever get diagnosed. Once they are diagnosed, they're presented really with two fundamental options. You can go into CPAP and wear a contraption over your face every night for the rest of your life, or you can have what's called a mandibular advancement device, which will actually protrude your lower jaw in an unnatural position to hold your airway open while you sleep, and you can wear that for the rest of your life. Either of those two modalities are going to present that patient with a life sentence of having to wear this contraption, one or the other, every night for the rest of their life.
The interesting thing about CPAP and oral appliances is although they're very effective treatments, if they're used over a lifetime, the person's condition actually gets worse over time.
Along comes Vivos and says, wait a minute, we have a better option that's all natural, non-invasive, non-pharmaceutical. We can say to a patient, you go into this oral appliance therapy with our protocols and you go through this treatment for 12 to 24 months. And at the end of that time, there's a high probability that you will no longer have to wear an appliance or any kind of device.
Vivos is literally changing my patients' lives.
It has drastically changed my life. I don't have to use the CPAP anymore. Within just a couple weeks of using the appliance, I was able to breathe through both nostrils, something I couldn't do my entire life. This was revolutionary. Pretty much made me feel excited about life again.
She's sleeping better, I'm sleeping better.
You really feel like you've been given a new life.
It's amazing. I wake up and I'm not in pain.
Because she's sleeping better, is her attitude during the day is better.
I have a better quality of life now. I can't say enough good about it.
I'm getting instant benefit from it. I was amazed. I dreamed every night for 2 weeks straight, and I told my wife, I said, it's amazing. I feel sharp now. I don't feel drowsy all the time. It's been a long time since I felt this good. I wouldn't lay down and try to sleep right now without my Vivos device.
My asthma has gotten much, much better. Without the Vivos, I wouldn't be outside right now. There's no numerical value you can put on this kind of a change. I smile, and I haven't smiled for a long time.
Right after I started using it, I noticed the results really, especially with the snoring. My sleep apnea episodes are a fraction of what they were before. This product's phenomenal. It changed my life.
It's a very comfortable process, but I can see dramatic differences. Now I can really open my mouth. Before it would almost always click.
His ADHD is calming down, he's doing better in school. I can definitely see the difference and the change in him. It's a miracle.
I get to do things now that I would not have been able to. I would not hesitate to do it again.
I am 100% happy that I did this, and I'm thankful every day that I have it because I can breathe.
We bring hope to the millions of people and the millions of families, men, women, and children who suffer from this disease.
It promotes the body's own ability to heal itself because now the body can breathe and sleep well. That's exciting.
That's extremely exciting, and that's something that Dr. Nadi offers. So we have finished the informative part of this meeting. Let's go ahead and turn it over to Dr. Nadi so she can answer your questions. Hi, doctor.
Hi, I'm Dr. Stella Nadi. If you need to get in contact with me, you can email me at info@cltsleep.com, or you can reach me at 704-900-5284. Take care.